If you ask business owners and executives from large and small companies in a broad range of industries during good and bad economic times to find one common concern, the rising cost of health insurance would be at or near the top of the list. The recently passed federal health care legislation has added to people's questions and concerns about health care. Today we have 5 people on the stage to help us sort through these issues. Each one of them brings a different perspective of the healthcare industry, coming from the hospital, a physician group, a long-term care operator, a health insurance company, and the pharmaceutical industry. Starting closest to me is Jack Bardo, CEO of New Hanover Regional Medical Center. Next is Jeff James, CEO of Wilmington Health Associates. Next is Charles Long, CEO of the Davis Community, and Garland Scott, CEO of United Healthcare of the Carolinas, and Bill Sharbaugh, COO of PPD Incorporated. If we could please give a round of applause for our panelists. I'm going to ask the panelists to start us off, and we'll start with Jack, to briefly share their views on the recently passed federal legislation. And do they view this legislation as progress, problematic, or somewhere in between? So, Jack, you want to summarize that in 2 minutes or less?
Probably all of the above. It's a first step. This was not health care reform. This was, to a great degree, insurance reform, and I'm sure Garland will talk a lot. There was a lot of efforts on that side. There's not a lot of dialogues about wellness, prevention, personal accountability, and lifestyle changes that I think that are important about it. It is going to move a number of uninsureds to getting insurance and getting some type of coverage, which I think from a provider perspective has potential to be positive. There are going to be cuts up until that point in time, but we're still going to have 20-some million Americans uninsured as we go through this process. So as I've said publicly a number of times, it's a first step. And it's not real health care reform, but it is insurance reform. And it is going to change how we do business. And I think Jeff will probably allude to that, and I will as well through the process and some of the others. But it is going to change how we do business. It is going to make us work together, and it is going to make us be more efficient. And I hope down the line we can drive some personal accountability to folks as part of this process.
Okay. Jeff, you want to?
I agree with Jack on most of those points. The interesting thing about it is the best opportunity for it is really in what's not there. It's the things that are promised and the things that are to come, the innovations that hopefully this will spark, the abilities for providers to change the paradigms of how they do business now. As Jack mentioned, it is going to cause us to work harder. We're going to have to do things like truly demonstrating quality in a meaningful way, not just talk about quality. The transparency is going to be very helpful for the consumer. It's likely to drive some of the fragmentation that exists out of the market. You'll see more consolidation between physician groups and providers, hospital providers, across the whole continuum of care. It's going to cause the provider community to work a lot more closely with the employer community. Ultimately because of the transparency that's involved. So it's not going to be simply the employers working with the insurance companies anymore, or the insurance companies working with the providers. It's going to be a 3-legged stool. And I think that has tremendous opportunities for employers as well as for all of our patients. As far as how I think it's all going to go, I don't know. I think, though, that we have to change. And I really am pretty bullish on the ability of this insurance reform, which I agree it is as well, to be a catalyst for innovation.
Charles?
I agree with these gentlemen. Being an employer and a provider really puts us on both sides of the fence with this bill. In the long-term care industry, we've been faced with low reimbursements for numbers of years, so we've had to work with other providers to accomplish our missions and provide quality services throughout our tenure. So we're used to those things. So in a sense, we're looking forward to it, being able to see more collaboration from the other providers. So I see it as progress. It's progress certainly for those folks who are uninsured and need to have insurance options available to them. It is going to be problematic in that it is such a huge bill with such far-reaching items that have to be taken care of. So I guess somewhere in between. It's going to be both progress and problematic for folks. And then there's going to be the cost of it, trying to sort out who's going to pay for what. And again, a lot of it, there are not even rules and regulations written yet. There are just laws been placed. The federal government has taxed the states with putting a lot of the rules and regulations in place, which is not done. So we really don't know what's going to happen at this point.
Great points across the board and a lot of agreement. And I think the one thing that you are seeing is there is a lot of consensus around what happened or what we're going to deal with. And first is the legislation did increase access. More people are going to have access to insurance. It took a good first step at creating wellness and prevention for individuals and groups. The challenge is obviously the affordability piece. What is the cost of it? And there's a lot of unknowns around that. It was a great point. The legislation has been passed at a federal level, but health insurance is regulated at the state level. So each state has a Department of Insurance that oversee and have to administer this. And it's still very much in the preliminary stage of decision making, a lot of unknowns. The goal should be for us to, as Jeff alluded to, is to collaborate. I think there's a lot of opportunity for providers, employers, insurers, everyone to collaborate around creating and developing and improving our healthcare delivery system.
Sure. I would say that the Patient Protection and Affordable Care Act epitomizes politics. Politics is about who gets what when. And I suppose the way to view this depends on the lens through which you're looking at it. So if you're a pharma company, you have a perspective. If you're a small business owner or employee, you have a perspective. If you're an insurer, you have a perspective. A payer, you have a perspective. And if you're a physician or a healthcare provider in some way, you have a perspective. At the end of the day, this isn't free. And so from a moral, ethical perspective, I think it's great. There is more access, and more of our citizens are going to be provided health care. The question is who's going to pay for it, and there is some insight into who's going to pay for this. I suppose we're going to get into that discussion here in a little while. So, my view is it is progress, but it's not free, and we're going to, as mentioned here, have to figure out what the details of this legislation are, because it's going to take years to unravel that.